Okay. We're good to go.
All right. Allison, could you kind of tell us, just introduce yourself and also tell us about your profession?
My name is Allison McCormick. I'm a licensed independent social worker, clinical practice. I'm also a business owner for Stepping Stones Counseling Services.
Great, great. And what do you do as a licensed social worker and therapist?
I see individuals, families, couples. I do group counseling. And what I provide is counseling to help people that kind of get stuck or have depression, anxiety, or having relationship issues. To move forward and to gain some skills to deal with life issues.
Okay, great, great. Since you talked about kind of what you do, what are some other type of counseling areas that other people in your profession could also go into, like specialties?
Some people would go into drug and alcohol treatment. As a social worker, some people would go into treating domestic violence specialties, sex offenders, working in group homes, working in the hospitals, in the hospital with mentally ill that are hospitalized due to crises, or group homes that have long-term placements and provide extensive counseling for those folks.
Okay.
Now, let me ask you this. So I think at least for me, what I used to think counseling was, and maybe some students think counseling is giving advice to people for their problems. And maybe some might think it's fixing the problems. But what, from your perspective, does it actually look like to help your clients?
If I had a magic wand in one of my drawers and could wave it around and fix people's problems, it would make my job so much easier. But it's really like a partnership between the client and the therapist to work on um, learning about their issues and what's going on with them, so that they can take ownership of that, and also learning skills to be able to deal with the issues and decrease symptoms and different things at some point. So it is not fixing a problem. It is working together in a partnership, because the person has to want to change and want to do something different. You can't just come plop down on the couch and something magical happens. You have to want to be invested in the process.
Yeah.
And I think that's another thing a lot of times people think of is just like lying down on the couch and someone's going to take some notes. Can you actually explain what a counseling session would look like?
I do have a couch. And I've had some people lie down on the couch because that's what they were expecting when they came in. But most of the time, people are just sitting on the couch. And for initial appointment, I'm gathering a lot of information and trying to find out what is the issue that has brought you in today? What has fueled you to come in and seek some help? And we go through history of the issue and what's been going on, symptoms, and how you've tried to change and help the situation. And we also go through family history and see if there's history of mental health issues in your family's past or your past, and trauma. Have you experienced a traumatic event or several traumatic events in your life? And you can have big T's or little T's. Big T's are huge events that have happened, and then little T's could be smaller things that maybe other people might have not found traumatic, but have been traumatic to you, that we need to work through also.
Oh, I like that. I like that big T, little t. I like that. Can you kind of tell us what type of education do you have to be a licensed social worker?
Okay. I attended Winthrop for my bachelor's degree, and that was a 4-year process, and had to complete internship with an agency in social work. And after I left Winthrop, I actually started working. I worked for a year. Winthrop at the time when I graduated, show my age, that they did not have a master's program for social workers. And so I went to USC and Columbia to complete my master's degree. And there is an advanced standing program through USC and Winthrop that if you have the social work, the bachelor's in social work, you can complete your master's in a shorter amount of time, in a year, if you already have that social work degree. But if you do not have the social work degree and have a related degree, so sociology, psychology, then you have to complete 2 years at either one of those schools. Or you could do part-time and do 3 years. And I was working already as a child protective services worker, and I chose to continue working and go part-time, and that was a 3-year process for that.
Okay, great.
And then after that, you have to complete a license, which is a testing through the licensing board of South Carolina to get the LMSW. And then you have to complete a process to have supervision with a mentor and supervision hours, staffing, learning new skills for at least 2 years to get that completed license and to become a licensed independent social worker clinical practice. And you have to get a second test.
Okay, and that latter part you mainly gain from being in the job, right? Underneath the licensed person?
Now, in the job, a lot of time, South Carolina has been slow with licensure. And so a lot of workplaces may not have a person who can supervise you. So you would need to seek outside supervision. And I'm actually a supervisor for social workers who are seeking that independent license. And most of the people come from other agencies and meet with me, and I provide that supervision for them to gain that independent license.
Okay. Can you kind of talk about the difference between being a social worker, a psychologist, and a counselor?
Okay. A social worker, we look at very holistic, and the system is what we're trained in, the system approach, where we're looking at the home, finances, the person, and any other things that are surrounded around them. Whereas other professions are looking at mainly at the person and what's going on directly with them and working with them. So the social worker is more of a systems approach, because it's hard to work on depression and anxiety if you're not having your basic needs met in regards to food and shelter and different things like that. So we would look at that whole approach and make referrals to other agencies and different things like that. I started off in undergrad as a psychology major, and going through that program, I realized that it was more of testing with the psychology major, that they were doing a lot of testing, such as like IQ scores and different things. A lot of the testings that the school district does for educational purposes and different things. And it wasn't quite what I wanted to do. I really wanted to be involved with the people and working directly with people instead of the testing part. So a lot of psychology, if you're you masters in psychology, usually you're doing a lot of testing and different things. Counselors, their approach is just a different approach, just a different perspective that they come from. But a lot of us do some of the same work, and we're all in the helping profession.
Great, great. Can you just also explain between those three, sometimes they only are looking for social workers in certain positions that a counselor or psychologist would not be able to like apply for a job. Can you explain that further?
Yeah, now I will tell you, the social worker, and we have the National Association of Social Worker, the NASW, and they have advocated for social workers greatly. And so certain positions, such as Child Protective Services in North Carolina, only social workers can hold those positions. At one point, they were grandfathering in psychology, sociology, and different other degrees in those positions, but the skills that are needed for working like in CPS are really geared towards social workers. I know that the Medicare, social workers, in regards to providing counseling and being a therapist for Medicare patients, social workers are the ones that can bill for that insurance, whereas other degrees have to go through a rigorous process to try and be able to bill in those areas. And like I said, social worker is more holistic in investigating, connecting with agencies and different things. And so that is the reason why like hospitals and things will want a social worker on staff to help with finding, connecting people with the community resources that they would need.
What types of skills would you say that students need to have to go into this career path?
I think that students would definitely have to have empathy would be the most important, be good listeners, be able to set aside biases against people. I think, and not be afraid to talk to different kinds of people in different communities and different environments. I think that you have to be willing to meet people where they are and to connect with others.
Yes, that's great. Can you kind of describe empathy?
Empathy is being able to connect with what another person is going through and understand from their point of view what is happening and the reason, thinking about why they are in this crisis at this time, what is going on, and understanding from another person's point of view.
Great, great.
I always like to think of empathy like literally putting yourself in their shoes and trying to imagine what it would be like to be in that person.
Mm-hmm.
So that's good.
Yeah, so you're not answering according to your viewpoints, but
Yeah.
you're helping guide them according to theirs. Yeah.
Yes.
So
you have to be aware of your biases and what your lifestyle has allowed you to be able to experience and understand that, and be able to set some of that aside to understand what the other person is going through.
Absolutely. So I'm sure many students want to know, how much money does a person in your field make on average?
I would say that starting out, a person currently in my field would start off with maybe in $40,000 a year, and as experience grows and skill level, gaining more trainings and different things, that you probably would be able to get up to in certain agencies, maybe to $80,000 in private practice. which I'm in, you'd be able to earn more than that in doing that.
Can you kind of talk about the pros and cons of owning your own private practice, and even the pros and cons of being a social worker?
I would say the pros and cons of being a social worker, because I've been a social worker for over 20 something years, and I've worked in different agencies and worked in different areas: child protective services, foster care worker, investigator. I've worked in hospital with long-term care patients, and worked for the Catawba Indian Nation as a director of social services for them, and worked for mental health for years also. And in those agencies, you had the constraints of the bureaucracy of how the state ran the agencies, and they set the norms across the entire state, when some of the areas of the state have different needs, but you had to follow the same rules and the same regulations, because everything was run on a higher level at the state level. And so that that could be good at sometimes, because it was supposed to be fair across the state, but it really sometimes limited you into what you could do. And so now working in private practice, I get to set my own rules and the way I want to practice. Of course, I have to have a standard of service, and making sure, and social workers have an ethical guideline that we have to follow, but I'm able to decide if I want to see somebody pro bono, then I can decide to do that if I feel like the services is really needed. And I can allow my staff to make their own schedule as needed, instead of having them to follow a strict schedule that's 8:30 to 5, which may not meet the needs of the clients that we serve.
Can you explain what pro bono means?
Pro bono means free, means that we would provide services, and we do have several pro bono clients that maybe they have lost their insurance or something, but the need for the service is so important that we are willing to donate our time to provide that services to those clients.
That's great. That's great. Do you have any last minute, what tips for our students?
I would, if you're going into social work, I would advise to do the advanced standing to gain to complete the master's degree in 1 year. I would also advise to volunteer, do a lot of volunteer work in different areas, to be around different people from different groups, so that you'll know what it's like to be around different people from different communities, and feel more comfortable working with different people. And so volunteer is a very big thing that I would say. The 1 year master's degree was excellent. Immediately go for your license. Don't wait. I think the state has really come up in requiring a lot of licensure across the areas. And I think that would put yourself at a more marketable place if you already have your license.
Great. Allie, anything else?
I think so. I think you answered all of our questions. I know we asked you a lot, so we appreciate you giving us the inside scoop. And I think you did a great job answering our questions. And I'm sure our students are going to learn a lot from this.
Yes. Thank you so much, Ms. McCormick. We really do appreciate this.
Well, thank you so much for having me and allowing me to speak for social workers across our area.
Thank you. Thank you.
Appreciate you. Have a great day.
Mm-hmm.
Bye.